Welcome to the Well at Work podcast from the University of Kentucky's Center on Trauma in Children. This podcast is made possible by a grant from SAMHSA to the Department of Behavioral Health, Developmental and Intellectual Disabilities and the UK Center on Trauma in Children. On this episode of the podcast, Dr. Tracy Clemans discusses skills for psychological resilience after loss.
Welcome to the Well at Work podcast, where we will be talking about managing grief in the workplace through strategies that increase psychological resiliency following loss. The loss of a client at work creates unique challenges for helping professionals. Employees may wonder how they're supposed to grieve the loss of a client, whether they have the right to grieve, or know who or where to turn to for support. Competing demands within an employee's personal and professional life can also make grieving challenging. Helping professionals may not have considered the intensity of their grief reactions when a client dies, especially if it was unexpected. Research indicates that the feelings of pain, loss, and isolation professionals experience when a client dies can be similar to feelings they experience following a personal loss. Some employees may feel like they are under increased scrutiny at work after the death of a client, which can certainly contribute to disenfranchised grief. Disenfranchised grief follows a loss that is not or cannot be openly acknowledged, publicly mourned, socially supported, or that is misunderstood. When an employee experiences disenfranchised grief, they may have had more difficulty emotionally processing and expressing their grief, and may not recognize new symptoms or behaviors that are related to grief. For example, when an employee returns to work after a significant loss, they may be able to fulfill their duties, yet they may experience symptoms like brain fog, causing their attention and focus to be elsewhere. You could see how this would make completing daily work tasks that were manageable before the loss much more challenging after. I'd like to tell you a story about Sarah, who has worked as a social worker at the Department of Juvenile Justice for 10 years. Sarah recently returned to work after taking time off following the unexpected death of an adolescent client she had worked with for several years. Upon her return to work, Sarah notices that her social support at home is adequate. However, her support network professionally is lacking, particularly at her organization, where she has been feeling isolated in her grief. Here are some tips that may help Sarah. First, assess and develop your social network. A strong social support network can play a major role in helping employees like Sarah cope with grief, manage stress, and improve emotional regulation and their overall well-being. One strategy may be consider developing a social connections map, where Sarah would write down her most important social connections and relationships, such as family, friends, and colleagues, as well as groups or organizations that are supportive. As she completes this activity, Sarah realizes she did not include some other sources of professional support outside her organization. She decides to reach out to 2 former colleagues who also experienced the loss of a client. She develops a goal to ask them to lunch, as talking with them about her grief may help the support and validation that would help her navigate this uncharted territory. Sarah begins noticing improvement in her feelings of confidence and competence at work after she meets with her colleagues. She walked away after this lunch feeling heard and validated, and knows she has a support network in place to help as needed in the future. Sarah also notices an intensity in her emotional reactions at work that she has not experienced before. She's increasingly irritable, angry, not sleeping well, which has negatively impacted her relationships with her coworkers and productivity at work. A second tip for Sarah would be to enhance her capacity to manage her grief reactions. This is accomplished through a series of steps that include things like self-awareness and monitoring, skill utilization, and practice. Sarah decides that the irritability and anger are 2 emotional reactions that bother her the most. She writes down situations that trigger feelings of irritability and anger, as well as early warning signs that typically lead to these reactions. Next, Sarah writes down several emotion regulation skills that were helpful when she experienced work-related anxiety in the past. It's important to remember resilient employees experience the same initial physiological arousal, and negative emotions when faced with a stressor as less resilient employees. However, the difference is resilient employees tend to be able to quickly calm down their sympathetic nervous system arousal and stimulate their parasympathetic nervous system, which helps regulate their emotions. For Sarah, activating her parasympathetic nervous system through breathing techniques and mindfulness exercises was successful in recent years, although ever since the loss of her client, she has not been regularly practicing these skills. Sarah decides to set reminders on her calendar and in her cell phone, telling her to stop what she's doing at various times during the day and choose one regulation skill to practice for at least 5 minutes. She does this at the beginning and end of her workday and in between client sessions. Sarah's regular practice of these emotion regulation skills begins to make it easier for her to manage her grief reactions at work, which gives her a renewed sense of hopefulness. Sarah even decides to try other strategies like going for a brief walk midday with a colleague and getting outdoors after work. Sarah's journey of coping with her client's death begins to improve through regular practice of these resiliency-enhancing strategies. We hope the tips highlighted today will support you and your staff should you be faced with a loss like this in the workplace. Thank you for tuning in to this podcast, and remember to stay well at work.
Thank you for listening to this episode of the podcast. Follow the link in the video description for more resources on our Well at Work website. And of course, stay tuned for more episodes on topics that will keep you well at work.